Good Sunday morning, folks, and thanks for joining us this Sunday morning. I hope you all are having a fantastic weekend so far. Well, joining us this morning, we are first talking about colon cancer awareness, different things that you need to look out for. And of course, we brought in a professional who knows everything about that and who can give us some great information. We have Dr. Valeska Valderas. She is a gastroenterologist for Texas Gastroenterology Institute. So thank you so much for joining us this morning.
Thank you for having me.
So tell us a little bit about exactly what a gastroenterologist focuses on.
Well, a gastroenterologist focuses on everything involving the gastrointestinal tract, heartburn, colon cancer, colitis, stomach issues, pancreatic issues, liver issues, and so we offer a wide range of services pertaining to gastrointestinal disorders.
Definitely. And I know we're talking about colon cancer awareness, and we just came off of March being a big awareness month to, talk about the different things to look out for and stuff like that. So why is this such a heavily talked about topic?
Well, it's so heavily talked about and so enforced to get screened for colon cancer because colon cancer is the #2 cause of cancer in the U.S.
Wow.
If you're diagnosed with colon cancer, 1 in 3 people will die from this. So what we try to do as gastroenterologists is get people screened so that we can prevent this cancer from coming about.
Definitely. And how does that process work? Is there a certain age group that it targets or that should be getting screened? Is there a certain time frame when people should be focusing on that, or is it kind of just going to the doctor?
So the average risk person who we recommend getting a colonoscopy on is a person who's age 50. Recently, the American Cancer Society has lowered that age to 45, and that's mainly because younger people are getting colon cancer, and they haven't really pinpointed why, but it's occurring at an alarming rate. For the average risk person, though, 50 is still the recommended screening age. We recommend this because colon polyps can form, especially once you reach the age of 50, and then they start to rise at an exponential rate. And so when we do the colonoscopy, we're actually preventing you from getting colon cancer. We can go in and find these little growths that are called polyps, and they're precursors to cancer. So our job as a gastroenterologist is to look at your entire colon mucosa, remove these polyps, and prevent you from getting colon cancer.
Definitely. And if there is something that you do find polyps, is something that they kind of have to just go and get checked every so often to make sure that they don't come back, or is it something that they have to monitor?
If you don't have any polyps during your exam and it's completely normal, you don't need another screening exam for 10 years.
Okay.
Now, if you do have polyps, you will be placed in a surveillance program. So let's say you have 2 polyps, you'll need another colonoscopy in 5 years.
Okay.
If you have more than 3 polyps, you'll need it every 3 years. And we do this because this is, you're already at higher risk for developing polyps if we find them. And so we want to keep surveillancing you so that you won't develop more.
Definitely. And what exactly is a polyp, or exactly? I know it is a buildup.
So a polyp is a growth of abnormal tissue cells that form into cancer. It starts out as a little growth that you won't even feel. And so that's why most people don't want to come in to have a colonoscopy, because they're not going to feel these tiny little growths inside their colon. But when they do grow to a large size, they can already start to form a cancer. And so sometimes we find large polyps that we can remove, and there's an invasive cancer within the polyp. Luckily, we're able to remove it all, and they won't need any further workup like chemotherapy or surgery. But the downside is that if you don't have a colonoscopy and this colon polyp grows to a large size that we cannot remove, most often this is a cancer already. At that point, they'll need surgery, they'll need chemo or radiation.
Definitely. And let's talk a little bit about the whole screening process, because I know it can be, I know a lot of people like to work things up in general when going to the doctors. They're afraid, they don't want to find out different information, or they're afraid it's too invasive. Let's talk a little bit about those myths or those things to kind of ease people maybe that they're watching right now and kind of want to calm them down a little bit.
So the biggest challenge is just what you said. Most people feel great. They don't want to come in to have this exam. But what is important to know is that it's the #2 cause of cancer in the U.S. Just like screening mammograms for breast cancer, pap smears, prostate screenings, this is a screening exam that your insurance actually covers. This is something they want you to get done. So it should be covered at 100% by most insurances. The other fact is that you're not going to feel any kind of symptoms when you have small polyps. We want to detect this early because it's a preventable cancer.
Of course.
Okay. Some people who have symptoms, however, need to come in to get screened. Okay. If you start to have symptoms of abdominal pain, rectal bleeding, any type of anemia that's detected, any sudden weight loss, any change in your bowel habits, those things need to be addressed, and you need to seek care by your primary care doctor, who can then refer you to us, or you can pick up the phone and call us, and we'll be happy to see you.
Definitely. And what are some of the questions that you typically get from different patients that are coming in, whether it's for their first time and they're getting screened for the first time, or it's they're going back again?
So one of the common misconceptions about getting the colonoscopy is that it's going to be painful. And you know, we have a great anesthesia team that is there to keep the patient safe and to keep the patient asleep and pain-free. And so there's no need to worry about any kind of pain or discomfort during the exam, because it's just non-existent. The anesthesia team takes care of them, and so this is something very common that people can, you know, question me about. Well, I don't want to have this done because I'm afraid it's going to be painful. And so that's not the case at all.
Right, definitely. And is this something that, if it's hereditary, is it if it's something that their parents or their grandparents have had, something to watch?
So if you have a family history of colon cancer, or a family history where your mom or your dad had colon polyps, you should definitely get screened, and right at 50. At certain times when your parents have had a colon cancer at a younger age, this usually leads to more genetic syndromes where people are more predisposed to have these types of cancers, and so that puts you in a different, higher risk category, and you should definitely get screened probably 10 years prior to when your first-degree relative was diagnosed.
Okay.
And so if there's any question of whether your parents or sisters or siblings had any kind of colon polyps or colon cancer at a young age, even breast cancers, ovarian cancers, uterine cancers, these are all alarm you know, signs that there may be something hereditary in your family, and you should get screened at a younger age.
Definitely. All right. Well, Dr. Vallejos, I want to thank you so much for coming in today and kind of sharing these tips and kind of information. And I hope that if you all are around the age that you do need to go get screened and you were afraid or you were nervous about it, I hope we did calm those nerves a little bit, because your health is very important, and it's make sure to take care of yourself and go to the doctor when you can, because they are there for to help you also. That's exactly what they are. So thank you so much for coming in today. We appreciate it. All right, folks, well, when we come back, we are talking to the folks from the American Cancer Society. Stay with us.